Good afternoon, ladies and gentlemen, and Your Excellency, Chairperson of the Africa Union Commission, Your Excellency, the Minister of Health of the Republic of South Africa, representing His Excellency President Cyril Ramaphosa, Your Excellency Dr. Leah Tadesse, the Minister of Health of Ethiopia, all guests, representatives of institutions, partners, ladies and gentlemen, I welcome you all to today's session on reimagining health workforce development in Africa, critical for Africa's health security. We are holding this side event in the margins of the 77th UN General Assembly at a time when we have experienced a lot of challenges during the pandemic. And the generosity of African countries during this time will hopefully one day be properly documented to show how Africa came together during this difficult time and worked through the pandemic to successfully keep the numbers down, to successfully ensure that our health systems continue to work, not just during, but also after the pandemic. We expect some resilience. I would like to invite His Excellency Minister Joe Fowler to give the message from His Excellency the President of South Africa, who are our hosts for this side event today. Minister Fowler, you have the floor.
Thank you very much, Honorable Chairperson of the meeting, our Acting Director General of CDC, Dr. Ahmed Okweli, to greetings to Your Excellency, the Chair of the AU Commission, Mr. Musa Faki Mohammed. Greetings also to Your Excellency, the former President of Liberia, Madam Ellen Johnson Sirleaf. All other ministers present, I saw my colleague, the Minister of Health of Ethiopia, all other dignitaries, heads of state and representatives of heads of state and heads of government, partners, and all other officials and esteemed speakers. As indicated by the chair of the meeting, who opened the meeting, I bring to you very kind and fond regards from my President, His Excellency President Ramaphosa, who is apologizing for not being able to be here due to other commitments. So whatever I'll be saying here, please keep in mind that when I say I, it's not myself as South African Minister of Health. I will be speaking on behalf of His Excellency, my President. President Ramaphosa says, I'm delighted that we have created this opportunity to come together as partners in the quest for a capable workforce that can deliver universal health coverage for Africa. He says, I believe that the theme for this year's general debate, which is a watershed moment, transformative solutions to interlocking changes, close quote, it's poignant for this side event that has brought us together here. Whilst COVID-19 is still in our midst, we have developed tools and strategies to be able to live with the virus and resume all our social and economic activities. However, the theme reminds us that we cannot go back to business as usual. We must be acutely aware of the transitional state of affairs and have the political, the moral, and business acumen to tackle the transformative elements needed to regain our path towards sustainable development goals. The AU's new public health order shines a spotlight on health workforce development as an enabler towards attaining the SDG 3 in terms of universal health coverage. Indeed, COVID-19 and other devastating pandemics like HIV and Ebola have taught us that failure to invest adequately in the health workforce has dire social and economic consequences. As we navigated the COVID-19, the world lost an estimated 180,000 health workers to this pandemic, and we continue to lose millions more to resignations. According to the Forbes magazine, some reports estimate a 20% overall loss, including 30% of which being 30% loss of nursing staff. All over the world, the healthcare systems are struggling to recover as the great exodus of exhausted and emotionally depleted health workers puts greater pressure on government to deliver services to a population that harbors a growing pandemic of other diseases, especially non-communicable disease. Health workers are a crucial pillar in a well-functioning health system, yet they have been historically deprioritized in discussions pertaining to the improvement of our health systems. Despite having 25% of the world's health burden, the WHO estimates that Africa has only 1.3% of the world's trained health personnel. Africa had an average of 1.30 health workers per thousand population in 2015, significantly less than the 4.5 per thousand needed to meet the SDG goals. Though gains have been made, Africa has the most severe health personnel shortfall, predicted to reach 6.1 million by 2030 out of the anticipated global health staff needed of 4.5 million, which is required to attain the universal health coverage. So a huge shortfall. Instead of 14.5 million by 2030, it's estimated that we will only have 6.1 million workforce. It is good economics to invest in health workforce, as the return on investment is measurable and dependable. The Organization for Economic Cooperation and Development and the International Labour Organization has shown that on average, health workforce investment generate a return on investment of 9 to 1. So out of, if you invest $1, you get a return of approximately 9. The Uganda Bureau of Statistics in 2019 reported an impressive 51 to 1 return on investment over 30 years. In addition, when one considers that 70% of women account for the health and social workforce, and that women are proven to have a much higher propensity than men to reinvest in immediate communities, one begins to appreciate the enormous multiplier effect that we can enjoy by investing in female-dominated workforce. 70% of our health workforce constitutes of women. So a major investment in terms of also gender empowerment. As the AU COVID-19 champion, I've been seized by these concerns as part of my campaign to address health systems strengthening post-COVID-19. I assembled a commission, now known as the AU COVID-19 Commission, to focus on the pillars of the new public health order and assist me to devise a strategy that advances these critical elements of the African health ecosystem. The AU COVID-19 Commission has done a sterling job in its focus on rebuilding the health workforce. They have undertaken a highly consultative process to understand the concerns of industry stakeholders and advised me to table key recommendations that would bolster Africa's CDC programs to build out a fully capable workforce for the continent. As I recently announced, they have also fostered strong partnerships, also a pillar of the new public health order, by working in close collaboration with civil society through AMREF, working with business through the Serum Institute of India, and also applied academia through the Sept Global Health. This is truly reflective of the multi-sectoral collaboration we always talk about, which yields tangible results at speed. Amongst the key learnings from stakeholders is that the continent needs to undertake a thorough gap analysis of the health workforce, which is particularly sensitive to the working realities on the ground, especially in the primary healthcare setting. Amongst this is also to acknowledge the key targets of 2 million community health workers by 2030, 6,000 epidemiologists, and also 25,000 frontline field epidemiologists. These are the targets. Stakeholders have also explained the importance of sustained investment through a pooled mechanism to avoid duplications, fragmentation, and a silo approach to health workforce development. They highlighted that it was critically important to standardize and homogenize accreditation to ensure maximal capacity for deployment both within the continent and also to serve the world as a whole. It became clear that the issue of health workforce development required a medium-term dedication that would sustain inward investment, training, deployments, and also retention to provide member states with bridge support until such time that they can accommodate the growing health workforce within their fiscus. It was through the revelations of these consultations and consultative sessions that we tabled a recommendation to establish a health workforce task team that would undertake this role in support of member states who are recovering their economies and also pursuing the Abuja Declaration to increase health spending in their respective sovereign states. The task team would see to the interim measures required to support growth by facilitating bridge financing and fostering a compact amongst member states that homogenizes policies and actions around issues of workforce needs, labor market, gender parity, public and private partnerships, monitoring and evaluation, and also emergency response. To ensure that this work is supported and driven by sound evidence, a foundational team is currently being established to draft the compact, design the mechanism, and devise strategies for the bridge financing and also increased domestic spending into the future. This work has been financed with the support of the Serum Institute of India. I am impressed that a manufacturer has seen the value of investing in people who ultimately deliver their products to patients, and I call on all other business and philanthropic partners to follow their example. We believe that while collective and centralized action may be ambitious, it will yield better results and tangible ground impact. The AU has the structure, political will, and enabling technology to coalesce around this critical issue of health workforce development. I want to thank my colleagues who have joined me in this high-level panel, of which I have the honor to establish. Your support is a real show of force to the world that the AU leaders take this issue very seriously. We are clear about what needs to happen, how it needs to happen, and what responsibilities member states will need to commit to those responsibilities for sustainability, the ability to retain the health workforce, and also for future growth. We implore all sovereign states, regional and international partners and agencies to stand behind the AU mandates and support actions we are taking towards tangible results. We truly believe that alignment is key to the success, and that the success that the world will gain from a strong Africa health workforce. I wish us all very successful deliberations in this session, and call on all of us here today to maintain attention and energy as we build the momentum behind this critical agenda. I thank you.
Thank you. Thank you very much, Minister Joe Fowler, for presenting that message from His Excellency President Cyril Ramaphosa, President of the Republic of South Africa. It now gives me pleasure, and it's my honor to invite the Chairperson of the African Union Commission to make his remarks.
Your Excellency Ellen Sirleaf, former President of Liberia, Your Excellency Minister of Health of South Africa, representing His Excellency President Cyril Ramaphosa, President of the Republic of South Africa, Your Excellencies Ministers, Commissioners, Ambassador Dr. John Nkengasong, Dr. Ahmed, Acting DG of Africa CDC, representatives of partners, distinguished guests, ladies and gentlemen. It is my pleasure to be here today to celebrate the essential life-saving work of our health workforce on the continent. The COVID-19 pandemic, the 2014 Ebola crisis in West Africa, and other disease outbreaks in Africa have not only exposed the acute shortage of human resources for health in Africa, they also underscore an urgent truth. Our world urgently needs more well-trained health workers where they are most needed, but they also urgently need more support. Some 180,000 health workers worldwide died from COVID-19 between January 2020 and May 2021, and others left the profession altogether due to exhaustion and burnout. On the continent, the loss is further aggravated by brain drain, where health workers seek better paid opportunities overseas. Reimagining health force development in Africa Excellencies, ladies and gentlemen, is therefore central to Africa's health security, especially as our continent bears 24% of the global burden of disease, yet only has 30% of the world's healthcare workers. Excellencies, ladies and gentlemen, the African Union, through the Africa CDC, has called for a new public health order to strengthen health systems for people-centered care. The new public health order and the lessons learned from COVID-19 pandemic present a historical opportunity to build a resilient and fit-for-purpose health workforce that can effectively respond to present and the future health crisis. In February this year, the 35th AU Summit of Heads of State and Government endorsed the call by His Excellency Cyril Ramaphosa, President of the Republic of South Africa and the African Union COVID-19 champion, calling for the establishment of an AU Health Workforce Task Force. The AU, through the Africa CDC, is in the process of establishing this team to support the development of a fit-for-purpose health workforce. This high-level event is part of the ongoing efforts of the African Union with partners to advocate for investment in health workforce development in Africa. Specifically, I urge you to join us to 1. Advocate for further investment in the development of health workforce in Africa, both in quality and quantity. 2. Strengthen monitoring, evaluation, and reporting on health workforce development with tools tailored to the African context. And 3. Let us actively mobilize the necessary resources needed for strengthening health workforce development in Africa. To achieve these important goals, the AU Assembly in February 2022 granted Africa CDC autonomy to be able to fulfill its mandate in support of member states to achieve health sovereignty through health force development, but Africa CDC alone cannot meet this challenge. I therefore look forward to your recommendations and insights as you reflect on how we can move forward together. I thank you.
Thank you. Thank you very much, Chairperson of the Commission. Now it is my pleasure to invite Her Excellency Madam Ellen Saleh, the former President of Liberia, and also from Africa Frontline Fast, to share with us her message for today. Your Excellency, you have the floor.
Your Excellency, Mr. Musa Faki Mahatma, Chairperson of the African Union Commission, Excellencies, friends, ladies and gentlemen, I'm grateful for this opportunity to support the work of the African Union, its member states, and the AU COVID-19 Commission, as well as the AU COVID-19 champion, toward advancing the health workforce on our continent. On the African continent and around the world, on health security, we are at an inflection point. The COVID-19 pandemic has affected every facet of our lives. The unnecessary toll of sickness and death from the pandemic is a blunt reminder that our personal health is inextricably linked to the health of all, especially to those living in rural and remote communities which are out of reach of the health system. In many of those places, community health workers, healthcare providers who live in the community they serve function as the foundation of the former health system. I learned this back in 2014 when the Ebola epidemic struck Liberia. With grateful support from the African Union, the US government, and our many other friendly nations, it took a shift in community-based responses, including enabling community health workers to help us curb and end the pandemic. This shift provided over the long term were able to protect Liberians from other infectious diseases such as malaria, the leading cause of Liberia's deaths. In Liberia and around the world, we have seen the power of community health workers to deliver essential care in rural and remote communities. It is only through empowering those communities that we can assure life-saving services will reach the most vulnerable, ultimately preventing another pandemic from happening. Unfortunately, as has been pointed out by the excellencies who spoke, in Africa up to 85% of community health workers, the majority of whom are women, are not paid for their work. It is time to correct this injustice. It is time to bring social justice into the mainstream of our work. Experience shows that professional community health workers who are properly paid, trained, equipped, and supervised are best prepared to provide essential health services in their communities, even if they great challenges. In Liberia, community health workers deliver half of the malaria treatment for children under 5, and there has been improved accuracy for diagnosing with rapid diagnosis tests from 70% to over 90% during the COVID period. For this reason, in May of this year, I led the launch of the Africa Frontline First Initiative, a collaborative effort to train and deploy 200,000 new professional community health workers in Africa by the year 2030. In support of the African Union's new public health order and COVID-19 commission, presided over by His Excellency President Ramaphosa, this collaboration pursues the African Union's broader target of deploying 2 million community health workers by the year 2030. A critical first step of the African Frontline Catalytic Fund, designed in partnership with a global fund. This catalytic fund seeks to mobilize at least US $100 million to improve community health systems in Africa and are providing essential medical care for up to 130 million people. By investing in the training and paying cadres of professional community health workers across Africa, Africa Frontline First will provide quality jobs for this primarily female workforce, extend across to essential primary care, and help prevent the next pandemic by expanding the critical surveillance network that is detected to detect emerging diseases sooner. I'm grateful for the anchor funding made by our partners Johnson & Johnson Foundation, which provided 15 million, the Skoll Foundation, 10 million, the Global Fund to fight AIDS, TB and malaria intends to launch and match this commitment and your commitment by at least a 1-to-1 match. The time to open up is now. The time to change is now. The time to act together is now. And I would like to see, as we go forward, the African Union, in all that they've already done to improve healthcare systems, will indeed give the fullest to member states to improve their national healthcare systems, which has as a basic element the community health workers. Mr. Chairman, I thank you for this opportunity, and before I go, let me just say that it has been a great pleasure to work with Dr. John Kangason of the CDC, as he provided the basis for some of the background work, some of the experience in the healthcare that enable us to become strong advocates of being able to push this. I also like to say with great thanks to the MasterCard Foundation, which acted very quickly and fully in granting support to CDC to enable us to carry out this very function for our continent. Thank you for the opportunity to speak.
Thank you. Thank you very much, Your Excellency, for that very clear message of support. Your Excellencies, ladies and gentlemen, you will recall that today was that day when the burial for the departed Queen of England was taking place in London, and quite a few of our heads of states are there providing that country with the much needed condolence and support. And in that way, some of our speakers could not be able to join us today. And as we proceed with the agenda of today, let us keep the people of England, indeed the whole of the United Kingdom and its territories, in our thoughts and prayers during this very sad time. Allow me then, Excellencies, ladies and gentlemen, to share with you just a few of our thoughts from Africa CDC on how we can reimagine our health workforce going into the future. Your Excellency, Chairperson of the Commission, Your Excellency, Minister Joe Fowler, representing the President of the Republic of South Africa, Your Excellency, Ellen Sirleaf, the former President of Liberia, Deputy Chairperson of the Commission, Commissioners of the Africa Union Commission present here today, Ministers, Ambassador John Kangason, Secretary General of IFRC, good to see you, all panelists, partners present here, with much gratitude to the MasterCard Foundation for the support they have been providing to our health workforce agenda. Ladies and gentlemen, let me start by sharing my gratitude for the opportunity to sit here together to discuss health workforce, not just for the continent, but what we believe is going to impact the whole globe. We are driven by two visions at Africa CDC. The first is Agenda 2063, the Africa that we want, particularly Aspiration 1, Goal 3, which speaks of healthy citizens. The second vision is a new public health order and in particular its pillar number 2, which speaks to strengthened health workforce. Apart from these two visions, we are also guided by two very key strategies. One is Africa's Health Strategy 2016-2030, which emphasizes the need for an equitable distribution of health workforce on the continent. And the second strategy is Africa CDC's strategy for 2022-2026, which lays a lot of emphasis on achievement of our goals through strengthening of the health workforce on the continent. Apart from these visions and strategies, our work in health workforce is also guided by the Africa CDC framework for workforce development, which advises on the multisectoral approach to workforce development, not focusing only on the health workforce, but all other experts that contribute to our public health. Secondly, this particular framework also urges programs for all cadres of professionals, including community health workers, meaning that as we build capacities amongst our health workforce, we should be able to cover all the relevant cadres of expertise that we need in addressing public health on the continent. Third, the framework also calls for strengthening of Africa CDC's Institute for Workforce Development, which has two very important parts. And one is leadership programs, and second is partnerships with African institutions. In doing so, the Institute for Workforce Development of the Africa CDC is then able to coordinate and guide workforce development on the continent by using infrastructure that is already existing here in Africa. We have learned a lot of lessons, not just during this period of the pandemic, but also in the pre-COVID-19 seasons. You will recall that Africa CDC, its formation was expedited by the crisis in West Africa caused by the Ebola virus. And indeed, in that crisis, we also did learn a lot of lessons that have helped in ensuring that our approach, strategies, and delivery of coordination on the continent for the COVID-19 pandemic has been successful. These outbreaks and the pandemic has shown us that health and socio-economic impact of health emergencies is huge on the continent. In fact, when we look at the health workforce needs during these emergencies, this pandemic showed a very significant deficit on the continent of Africa, and the disruption in health services continues to remind us that we are having much less than optimal numbers of expertise within the health sector. Despite all these challenges, we have also seen some progress that we have made as Africa CDC and the Africa Union here on the continent of Africa. Our successful response to the COVID-19 pandemic was and still is strongly hinged on early diagnostic capacity building and deployment of the right health workers to all of our Africa Union member states that may need it. Africa CDC has made giant leaps in improving health workforce on the continent through capacity building and strengthening programs and interventions that are geared towards improving public health and leadership competencies in Africa. It is worthy to mention three of these. The first is the Kofi Annan Global Health Leadership Program. This program is currently in its second cohort and has successfully graduated the first cohort of 20 fellows as public health leaders on the continent. The representativeness of our first cohort, cutting across 15 member states of the Africa Union, is a testimony to the interest and need for leadership in public health here on the continent of Africa. The second cohort is currently undergoing training, and we expect to call for a third cohort in November of this year. The second initiative worth mentioning is the Africa CDC Ministerial Executive Leadership Program. This particular program is aimed at supporting our health ministers to be able to address issues around health security on the continent in a way that is in line with Agenda 2063 and the new public health order. The third that is worth mentioning is training for preparedness and response to health emergencies, including field epidemiological training programs, public health emergency operations program, as well as the program for bioinformatics. As we reimagine health workforce on the continent, we need to remember, as has already been said, that Africa has significant shortages of health workers, and this will require our careful planning and investment to ensure that their education, their employment, retention, and distribution across the continent responds to the priority areas for public health emergencies. Furthermore, the emergence of the COVID-19 pandemic has exposed the need for us to rethink and redefine the approaches that we use in health security on the continent. We therefore have identified the following 4 areas that will require our attention in the process of reimagining health workforce on the continent. First is we need to, in this 21st century, translate our efforts into both health and economic gains for Africa, so that we see investment in health as actually an investment and not a service that consumes resources. To back this up with evidence, Africa CDC is working to conduct a health impact assessment and a continent-wide fiscal space analysis to clearly identify both health and economic gains and challenges that we have faced during this pandemic. The second area is accelerating investment in the female workforce. As Her Excellency clearly pointed out, the vast majority of our health workers are actually female. In reflecting on our current realities and forecasting the future of Africa's health security, gender equity will remain at the core of our model to ensure that the optimal maximization of female workforce is planned for and delivered for a more resilient health system in Africa. We can achieve this by putting in place gender transformative healthcare policies. Third is the need for private sector collaboration, and this we can do by scaling up innovative approaches to ensure that as we develop and strengthen our skilled health workforce on the continent, we utilize the broad infrastructure of the private sector in Africa. Finally, monitoring and evaluation of all the public health workforce programs and initiatives on the continent is critical, because only what is measured is done. We can do this through clear, high-quality, comprehensive and interoperable sources of health workforce data to present the evidence that we need that investing in health workforce actually does give benefits to our socioeconomic development. Excellencies, distinguished guests, ladies and gentlemen, as we conclude, I would like to remind us that very recently, under the leadership of the Republic of South Africa, the UN General Assembly passed a resolution to establish a high-level meeting for pandemic preparedness and response. I would really urge our member states and partners to ensure that as these discussions on the high-level meeting for pandemic preparedness and response continues, that health workforce is at the core of those priority issues that are going to be covered under the high-level meeting. I wish us all very productive deliberations today, and we as Africa CDC are looking forward to your wisdom, your recommendations to ensuring that we truly reimagine health workforce development on the continent of Africa. I thank you. Excellencies, I would now like to invite Dr. Raji Tajuddin to moderate the next session. Taj, you have the floor.
So, Your Excellencies, distinguished participants, ladies and gentlemen, all protocols duly are observed. The COVID-19 pandemic and the ongoing multi-country monkeypox outbreak have actually shown that a fit for purpose and adequate health workforce are needed globally now more than ever. And it's high time we recognize the value of healthcare workers in keeping our world secure and safe. And a strong health emergency preparedness and response architecture can only be guaranteed with a competent health workforce. The 77th UN General Assembly has presented us with another opportunity to reimagine health workforce development in Africa for Africa's health security. So on that note, we have partners who are here to actually give us their remarks as far as this particular second session is concerned. And to set the ball rolling, I would like to invite Madam Julie Dijuru, who is the Chief Public Affairs and Communication Officer for MasterCard Foundation, who is representing Ms. Rita Roy, the CEO of MasterCard Foundation, to set us rolling as far as this session is concerned. Julie, the floor is yours.
Thank you very much, Dr. Taj. Your Excellencies, ladies and gentlemen, it's a great pleasure to be with you all today to talk about the development of a robust health workforce. This resonates very, very strongly with the MasterCard Foundation, as our work is guided by a strategy, Young Africa Works, that seeks to enable 13 million young people, particularly young women in Africa, to access dignified and fulfilling work by 2030. And so allow me to give you an insight into some of our work, because we are already walking this journey. This year we mark 10 years of the MasterCard Foundation Scholars Program, an education and leadership development program that has enabled nearly 40,000 young people to pursue their secondary and higher education. Many of those have gone into public health. Over the last 2.5 years, we have worked with the Africa CDC to respond to the pandemic. As many of you in this room know, in 2020, we trained, equipped, and deployed over 12,000 community health care workers under the Partnership to Accelerate COVID-19 Testing and Tracing Act. Again, as many of you know, last year we launched Saving Lives and Livelihoods, a $1.5 billion partnership with the Africa CDC to purchase vaccines for more than 65 million people on the African continent, to enable vaccinations for millions more, to strengthen the Africa CDC, and we are also laying the groundwork for vaccine manufacturing through a focus on workforce development. Moving forward, additionally, I'm excited to let you all know that we are working with the public and the private sectors and with academia to grow Africa's health workforce. The foundation is convening a $200 million collaborative with 7 African higher education institutions and the University of Toronto to train 30,000 primary healthcare workers, launch over 2,000 health ventures that will create more than 10,000 work opportunities, create a vibrant, dynamic network of higher education institutions, insurance providers, innovators, and private sector actors to contribute to economic growth and resilience in the health sector. Yesterday, at the Africa Center right here in New York, we convened to talk about respectful, action-oriented partnerships. As partners of the Africa CDC, we are listening to emerging needs. We are connecting the dots on our ongoing work, and we are remaining agile and responsive to ensuring that the continent is able to deliver the new public health order. And also, let me use the words of His Excellency Musa Faki Mahamat, is able to build a resilient, fit-for-purpose workforce. Reimagining the health workforce is critical, not just for health security, but also for economic security on the African continent. We are committed to this work, which must be driven by innovative, action-oriented partnerships, built, as we said earlier, on respect. We will continue to work with Africa CDC and other partners towards these common objectives. Let me finish by reiterating the words of Her Excellency Ellen Johnson Sirleaf. The time to act together is now, and we are walking this journey together. Thank you so much.
Thank you, Julie, for those great remarks. At this junction, it gives me a very great and special pleasure to invite Ambassador John Nkengasong, the U.S. Global AIDS Coordinator and Health Diplomacy, to give his remark. Dr. John, the mic is yours.
Excellency, it gives me a pleasure to really have been invited to share some reflections on what PEPFAR can do as Africa CDC moves forward with strengthening workforce on the continent. Let me spend a few minutes bringing up to speed some of you that may not be too aware of what PEPFAR does. As you all know, PEPFAR stands for the US President's Emergency Plan for AIDS Relief that was established in 2002. So next year, 2003. So next year, PEPFAR will be celebrating its 20th anniversary. It was established at a time, a critical point where the world was confronted with the fight against HIV/AIDS, which was devastating many parts of the world, especially in Africa. Life expectancy had dropped significantly. Families were shattered, and it generated tremendous fear and hopelessness in the societies. I recall a few weeks ago in Geneva when I met with Dr. Tedros to think through what PEPFAR has done. He summarized the achievement of PEPFAR in 3 words: hope for the family, hope for the individual, and hope for the nation. I start there, Excellency, just to reiterate that over the last close to 20 years, the program has invested $100 billion in Africa to support the fight against HIV/AIDS and has strengthened tremendous health systems, including workforce development. Just to run some numbers by you, over the last close to 20 years, PEPFAR has trained over 300,000 healthcare workers, strengthened and established over 3,000 laboratories, strengthened over 70,000 health facilities, and trained several hundred epidemiologists. In March this year, Excellency, you recall you signed a memorandum of cooperation with Secretary Blinken as part of Africa CDC's partnership with the United States government to continue to strengthen several components of global health security, including workforce development. Biden and Harris administration is committed to strengthening workforce development. They've just launched the Global Health Workforce Initiative, which aims to continue to strengthen workforce across the world, especially in the context of health security in several dimensions. And we truly hope and look forward to working very closely with the African Union and Africa's CDC to move these programs forward. Workforce, as the new public health order that Dr. Umar laid out has outlined, is critical component of the new public health order that you have announced. And we as partners stand by to support you in this initiative as you implement your new public health order for the continent. We hope that as we move forward with this initiative, we look at several cadres of workforce development, including nurses, medical doctors, epidemiologists, and community healthcare workers. We believe that we can leverage the power of PEPFAR, which is a vertical program, as well as the United States-supported President's Malaria Initiative to advance the cause of expanding workforce development on the continent of Africa to meet the challenges. Let's work together, and you can count on us as partners that we use the PEPFAR platforms to support the initiative as much as possible. I thank you for inviting us to be part of this dialogue.
Thank you, Ambassador John. At this junction, we would like to excuse His Excellency Chairperson Musa Faki Mamad for another critical engagement. Excellencies, distinguished delegates, ladies and gentlemen, it gives me a great pleasure to introduce the Deputy Chairperson of the AUC, who has just stepped in to take over from the Chairperson, Madam Monique. Thank you for joining us. So, to continue our session 2, so I would like at this junction to introduce Dr. Priya Basu, the head of Secretariat Financial Intermediary Fund on Pandemic Preparedness, Prevention and Response at the World Bank, to give the World Bank Group a remark. Dr. Basu.
It's a great pleasure to be here with you today. I wear a few hats, one at the World Bank in charge of the COVID-19 response, and then another heading up this new secretariat for the newly established Financial Intermediary Fund for Pandemic Prevention, Preparedness and Response. Let me first say a few words on behalf of the World Bank's Africa region. We have a long and deep partnership with Africa, and we're very proud to be partners with Africa across so many areas, including health and including the COVID response over the past 2 years. The World Bank has continued to deepen its partnership with the Africa CDC. I'm pleased to share that in July of this year, a $100 million regional financing project was approved to support the Africa CDC. Our vision is very aligned with the new public health order that was referenced, that's been set out by the Africa CDC with a focus on immediate needs as well as long-term needs. The project will help scale up the support of the Africa Volunteers Health Corps, and the goal is really to build a health workforce for the future. We do believe that a strong and resilient health workforce really is the cornerstone of health systems strengthening. If you allow me, maybe just a couple of words on this new Financial Intermediary Fund for Pandemic Prevention, Preparedness and Response. This is a partnership between a large number of governments, international organizations, civil society organizations. The fifth as we call it, was launched on September 8th when it had its first governing board meeting. It is hosted by the World Bank, which is serving as the secretariat trustee and also as one of the implementing entities. It is the product of a consultative process within the G20 and beyond, with civil society organizations, with a range of stakeholders. We now have 22 donors to this fund, and I'm very pleased that South Africa has joined also as a donor to the fund. We've already mobilized $1.4 billion, and there's more to come. There are many more donors that will be joining us. This is the first ever dedicated financing mechanism for pandemic prevention, preparedness, and response, with a focus on low-income countries and middle-income countries. The objective is to strengthen the capacity of low and middle-income countries to face the next pandemic, but also to prevent future pandemics. It will make investments at the national level, at the regional level, as well as at the global level, by addressing gaps in international health regulations and in One Health standards. And some of the key areas where the fund will invest include building a strong and resilient health workforce in these countries, strengthening disease surveillance, laboratories, community engagement, emergency coordination and management, as well as investments in vaccines, therapeutics, diagnostics, and other critical medical countermeasures, so as to prevent the kind of situation we saw in COVID-19, which was that it was very hard for poorer countries of the world to access affordable vaccines and other medical countermeasures. And some of the key principles on which this fund will be based is complementarity between with the work of existing institutions, including multilateral development banks, the WHO, UN agencies, Global Fund, Gavi, Sept. This fund will channel resources through all of these existing mechanisms. It is not meant to be a new institution. It is intended to promote coordination and to serve as an integrator rather than creating yet another silo. We also will ensure that every dollar of grant financing that this fund provides incentivizes countries to invest their own resources in pandemic prevention, preparedness, and response. It has been designed with inclusivity and agility, with an equal representation of donor countries and potential recipient governments on the fund's board. It includes civil society voice as voting members, and we hope that it will serve as a platform for advocacy going forwards. And it will operate with the highest standards of transparency and accountability. So the fund will issue its first call for proposals around November. It will be designed in a way, the call for proposals will be designed in a way that it really does attract country-led, country-driven ideas and proposals for funding, and that every proposal helps strengthen country-level national plans on health security and promotes coordination amongst all the partners that are working at the country level. So we're very much looking forward to working with all of you and supporting your efforts and initiatives in strengthening pandemic prevention, preparedness, and response. And we will be in touch with you. We already are in touch with many of you, and we will be in touch with you as we issue the call for proposals. And hopefully, this fund is one part of the solution, but we hope that it will help build that momentum for strengthened pandemic prevention, preparedness, and response. Thank you very much for your attention.
Thank you, Priya, for that great remark. So at this junction, I would like to invite Professor Maha Rabah, former Minister of Health of Egypt, and member of the AU COVID-19 Commission, to deliver our remark. Prof, the mic is yours.
Briefly, I'm going to go through the new compact for health workforce development in Africa. But before speaking about it, I would like to tell you, or to just think about the challenging situation of the continent. So the health needs across the African countries, they have and they will continue to evolve over the years, so changing, increasing the demand of the health services, aging population, youth booms, double burden of disease, higher mortalities among women and among children, among other vulnerabilities, the emergencies, the climate change, all of those challenges or all of those dynamic changes will require a new oversight about the blocks of the resilience of health systems and of the needs for the health workforce together. So Africa has a chronic shortage, and this has been mentioned, and I don't want to go through it again, but it is compounded as well, not only with the shortage of health workforce, but it's compounded by the gaps in the service delivery and the service coverage, with the inadequate skill mix, inadequate training, underinvestment in the health sector. So the health workforce poses a challenge that hampers health systems strengthening and resilience and people-centered approaches for the achievements of the universal health coverage. So we always talk about the health workforce in terms of the availability, the accessibility, acceptability, and quality, but there are other difficulties as well that really hampers all of those factors that are needed for a well-functioning health workforce. We have difficulties not only in the numbers, but as well for varying degrees with education, the training, employment, deployment, the succession plans, and as well, most of what is happening is not really responsive to the people's needs for the health and in the financing. So the African Union COVID-19 Commission, which is headed by His Excellency President Ramaphosa, in his role as the AU COVID-19 champion, has prioritized the health workforce agenda in line with the new public health order by securing a mandate to establish the AU Health Workforce Task Team to support the implementation of the Africa CDC framework for development. And this is going to be done through a compact, a social compact that is fostered amongst the member states to frame a pathway that really ensures the adequate and capable development of health workforce to satisfy the health needs of the people. What is needed is for the achievement of health, for the achievement of the universal health coverage. And this pathway will harmonize governments together and partners' actions towards a common vision, ensuring dynamic, sustainable actions, resource and finance, with metrics and with measurements for the fairness, equity, quality, and universal health coverage. So the compact should bring together the governments, the businesses, academia, the labor forces, the civil society to address all the structural deficiencies, but at the same time to hold this form of accountability that is held to the outcomes that should be reached. So saying this, the compact serves as an evidence-based operational framework and as basis for continuous tracking within the principles of inclusiveness and recovery, defining goals, setting the targets, and outlining the member states' peer support mechanisms and innovative modalities to collectively grow the health workforce. What we really need to understand is that whatever is being done, it has to be contextualized according to the different situations, the different systems of the countries. So contextualization is important as well. And the functionality of all the actions and all of the frameworks that are going to be developed and the tools, and what we aim for is this sustainability. So the task force as well, with what is happening with the compact, will mobilize the needed resources to provide and to bridge the support to member states to support them as they grow their fiscal space. So in a way, it's like a bridging step for future actions that needs to be undertaken. On a second level, on a second front, but complementary for the AU, for the compact and for the health workforce task team, the African Union secured as well a mandate to establish the Alliance for Health System Strengthening. And this is really important to support member states as they build forward better. So we always say now this is the time, the opportune time, the window of opportunity. We need to look forward how to build better. And in a way, the health system strengthening involves securing, monitoring the sustained financing required to retain the health workforce and the capacity building. So saying this, and I don't want to go through much details about the investment, but there is an investment case that needs to be undertaken when we're talking about the health workforce development. But this investment should be phased according to the framework or according to the phases. So we have like immediate or short-term investments. We have mid-term investment and longer-term investments that have to be undertaken. For the immediate, then we're talking about evidence generation, for the target setting, for training, capacity building, fitting in the rapid gaps that are available. And for the mid-term investments to deploy the health workforce in accordance to the set targets that are prepared for each country and according to the context. Longer term, we really look at the succession plans, the retention, the protection, and here I want to emphasize the importance of having succession plans, or else whatever development actions are undertaken for the health workforce development are not going to be sustained. So partnerships are really needed, and I think that in the second session, following session, partnerships are going to be properly discussed. So the partnerships are needed, and as has been mentioned, we need action-oriented partnerships to secure innovative financing mechanisms to close the gaps on the short term, the middle and the longer term, and as I mentioned, for the retention and succession. But what is really important, we need to think of how to mitigate against the brain drain that is taking place. And in a way, states should at a certain point assume the primary responsibility for the retention onward by committing to increasing the domestic spending on health, and this requires a paradigm shift in how the political leaders prioritize and commit to health as an investment rather than an expenditure case. Finally, I'm just going to mention the foundational work of the task team, the developed task team, and it should include a number of actions that are taken successively or together in parallel fashion. So there should be evidence-based target setting, articulating the investment case at each stage, identifying the partners, facilitating the consultations with the partners to set the scene, clarify the roles and responsibilities, and to agree on the sustainable actions, sustainable financing, develop a framework for monitoring and evaluation, and this has been repeatedly mentioned by colleagues, and what is important is accountability as well. And facilitating the member states' compacting exercise to ensure standardized, homogenized approach in the African Union. So we want to build trust, we want to build commitment, we want to build sustainable actions, and overall confidence in actions that are undertaken on the shorter and to the longer run to maintain, enhance, sustain the political and investor support and commitment. Finally, the last point I would like to add is that we need to create platforms, innovative platforms and modalities that facilitates the work, like for example, the cross-country learning, identifying and leveraging the different country strengths, working on those strengths, identifying gaps and weaknesses, and working on them in a way that would support the continent as a whole and endorse the collaboration between the countries. Definitely this would require policies that would require more advanced regulatory functions for the different manner of this cooperation and collaboration, which should be, and mechanisms as well, and that should be strategically put in place. And thank you very much.
We've heard the role of partners as far as health workforce development on the continent of Africa is concerned. We have also heard how do we make use of existing platforms, existing mechanisms to drive our health workforce agenda. We've heard how PEPFAR can actually support that. We have also heard the role of financial intermediary fund, the newly established World Bank Fund, and how that can be leveraged to further drive our workforce agenda on the continent. And last but not the least, we've heard from the AU COVID-19 Commission under the leadership of President Cyril Ramaphosa, especially the new compact for health workforce development in Africa and the need for an accountability framework. Thank you, and at this junction, I would like to hand over to the CEO of Sept Global Health, who is going to take us through the third and the last session of this high-level side event. Vanessa, the mic is yours.
Thank you very much, Dr. Taj. And good afternoon, everyone.
Good afternoon.
Hoping to have it. It's nice to see you, Esther. I'm hoping to be able to draw out the deep experience and examples that we know can illustrate the power of the health workforce with our very esteemed panel, and then with some participation of some of the honorable ministers in the audience and our partners who are also here. So thank you to the acting director, to the deputy chairperson, to the representative for President Ramaphosa, and for all of you for joining. It is a pleasure to be here today. I have the privilege of having a panel that includes Her Excellency Commissioner Samate Sissouma, who's the AU Commissioner for Health, Humanitarian and Social Affairs, Minister Lida Tedessi is Minister of Health of Ethiopia, and Professor Magda Robala, who is the Global Managing Director for Women in Global Health, and a former Minister of Health, I believe, herself. So I'd like to start actually with our esteemed panel, and if I may, and I'm going to start with calling on the Commissioner to kindly guide us from the position of being the EU Commissioner for Health and Humanitarian and Social Affairs, and from all the multiple positions you have held. And actually, I can't see because I've got a pillar, so I want to make sure. Thank you. Excellent. Okay, thank you. Suddenly it's like, am I calling into the ether? I would be very grateful if you could weigh in on the power of health for and investing in the health workforce as a mechanism for economic growth, social advancement, and for being able to bridge sectors and seeing the progress that we see. Your Excellency.
Merci, Madame la modératrice, Dr. Vanessa Kiri, Monsieur le ministre de la Santé de la République d'Afrique du Sud, Madame Monique Nsanzabaganois, excusez-moi, Madame. La vice-présidente de la Commission de l'Union africaine, mesdames et messieurs les ministres présents dans la salle, Dr Ahmed Ogwel, directeur par intérim de CDC Afrique, mesdames et messieurs les ambassadeurs, représentants permanents, distingués participants du protocole d'humain observé. C'est un honneur pour moi, mesdames et messieurs, de participer à cette réunion et surtout insister sur la nécessité de mobiliser. Et c'est avec honneur que je participe à ce panel afin de nous permettre ensemble de voir comment nous pouvons mobiliser et renforcer les ressources qui soient nécessaires à l'amélioration des conditions de travail du personnel de santé au niveau de notre continent. On ne cessera jamais d'insister sur la pandémie actuelle, la pandémie de la COVID-19 depuis 3 ans maintenant, qui a mis en évidence une grave pénurie en matière de ressources humaines dans le domaine de la santé sur notre continent. La COVID nous a permis de prendre conscience, de travailler pour avoir un personnel de santé bien formé, bien réparti, personnel de qualité et doté même de ressources suffisantes. Et la création de l'équipe spéciale de l'Union africaine sur le personnel de santé constituera, j'en suis certaine, un effort particulier pour notre continent en matière de soins de santé et surtout la mobilisation de milliards de dollars et nous permettant justement d'aligner nos efforts sur les priorités de notre continent en matière de santé avec des systèmes de santé de qualité et surtout nous assurer aussi une sécurité sanitaire et permettant une croissance économique. Mesdames et messieurs, la stratégie de développement du personnel de santé définie par la Commission ICDC Afrique aidera les États membres à mobiliser des investissements plus soutenus en matière de formation et surtout la rétention du personnel de santé. Il a été dit que nos gens très bien formés, nos médecins se retrouvent en dehors du continent. Il nous faut retenir justement ce personnel qualifié et qu'on puisse bien répartir cela sur le continent. Notre stratégie vise aussi à harmoniser la vision de nos gouvernements et également des partenaires de notre continent pour la mise en œuvre justement conjointe avec responsabilité aussi bien à notre niveau qu'au niveau de nos États membres. Mais pour répondre un peu à la question, comment pouvons-nous accélérer l'investissement dans le personnel de santé? Et là, j'interviendrai au niveau de nos États membres. Les États membres, on a la chance d'avoir nos États membres avec nous. Ces États membres sont invités à élaborer des stratégies qui puissent nous permettre de répondre aux besoins sanitaires et s'appuyer sur les infrastructures sanitaires de qualité, la technologie et les ressources humaines que nous avons sur le continent. Il nous faut nous attaquer à la charge de morbidité et nous ne pouvons pas atteindre cela au niveau de nos États membres sans investir justement dans ce domaine. Je voudrais aussi à l'attention de nos partenaires et les bailleurs de fonds d'une manière générale, que ce soit les bailleurs de fonds bilatéraux et multilatéraux, ces bailleurs aussi doivent s'aligner sur nos priorités. Nous connaissons nos priorités et ces partenaires doivent nous soutenir. Nous devons galvaniser également les allocations budgétaires sur le plan national. Et cela nous paraît vraiment important. Nous devons nous-mêmes mettre la main à la poche pour faire ce travail. Et je ne saurais oublier aussi le secteur privé. Le secteur privé doit jouer un grand rôle et il nous faut ensemble justement stimuler les politiques de santé au niveau national. Nous devons offrir une compréhension détaillée de nos principales contraintes. Nous en avons et nous avons conscience de cela. Il nous faut justement investir pour nous permettre de disposer de fonds et relever justement les défis et s'attaquer aussi à ces contraintes. Les stratégies que nous avons devront nous permettre à nos États de concevoir une formation de qualité, fidéliser notre main-d'œuvre, établir des coûts de nos plans. Il nous faut planifier sur plusieurs années et mettre en œuvre les plans justement que nous avons. Dans cette quête que je pense, multiforme de santé et de développement durable, nous ne devons pas oublier les communautés. Nos communautés représentent une ressource unique et puissante. Ces communautés en bonne santé, qui soient autonomes, qui connaissent la prospérité, sont les moteurs de base de la croissance nationale et aussi que ce soit au niveau national, régional et continental. Sans ces communautés, nous perdons des partenaires vraiment importants qu'il nous faut galvaniser également pour apporter leur contribution. Si nous avons les communautés avec nous, que ce soit des partenaires et les leaders, toutes nos aspirations en matière de santé et de développement ne seront guère plus que de la rhétorique, mais des vœux pieux si nous ne faisons pas attention. Les agents de santé sont la pierre angulaire des soins et ma conviction est que la formation, l'autonomisation et l'intégration des agents de santé communautaires dans les systèmes de santé existants permettront d'étendre les soins et de réduire la charge de morbidité de millions d'Africains. Il est prouvé que ces agents de santé sont vraiment importants parce qu'ils permettront de réduire les inégalités en matière de santé en fournissant des services de qualité et qui puissent nous permettre d'améliorer les résultats globaux en matière de santé. C'est dire, mesdames et messieurs, que l'investissement dans le personnel de santé est vraiment important parce que cela crée aussi des possibilités d'emploi décent, en particulier pour les femmes. Les femmes et les jeunes qui sont la majorité sur le continent africain. Et cela contribue à soutenir nos économies et une augmentation de la productivité si nous avons un personnel en bonne santé. Les investissements dans les agents de santé permettront de transformer ce dividende que nous avons. L'Afrique est un continent jeune. Il nous faut transformer justement cela en dividende démographique qui soit dynamique et qui stimule la croissance. Si ce dividende aussi est en bonne santé, et cela améliorera le niveau de vie. C'est pour ça aussi que les chefs d'État et de gouvernement ont adopté l'initiative de 2 millions d'agents. Cela a été déjà relevé par certains avant nous. Et cette initiative est vraiment importante qui appelle au recrutement et à la formation et au déploiement de 2 millions d'agents de santé communautaires supplémentaires sur le continent afin de relever le défi du manque de bonnes capacités, surtout en matière de ressources humaines de santé et de qualité sur le continent africain. Cette initiative est importante parce qu'elle nous permet d'augmenter les agents de santé de nos différents pays et sans oublier aussi l'appel qui avait été lancé en 2019 pour intensifier et renforcer le personnel de santé communautaire sur le continent. Pour terminer, mesdames et messieurs, je lance un appel pour que nous puissions investir dans le personnel de santé. C'est à ce prix que nous atteindrons la couverture de santé universelle. Nous allons améliorer les résultats sur le plan sanitaire, particulièrement au niveau de nos communautés en matière de soins de santé. Et c'est à ce prix aussi que nous allons atteindre la sécurité sanitaire sur le continent africain. Je vous remercie et je retourne la parole à Madame la modératrice. Et merci pour l'occasion qui nous a été donnée d'échanger avec vous.
Merci beaucoup. That was an extraordinary, I think, coverage of some of the key issues about investing in the workforce. And I'm very appreciative of your covering partnerships, which was going to be a key piece of what I was hoping you would discuss is the power of partnership to mobilize and the critical role of the health workforce for our pandemic preparedness, for the strength of our public health institutions. And so I thank you very, very much for your comments. I would like now to actually turn to the Honorable Minister from Ethiopia to share a little bit about the extraordinary investments and progress that you've been able to mobilize with partners for the health workforce in your country. And if you could, I think many people sort of want to see these examples, and it would be terrific if you could share with us the ways in which Ethiopia has been able to leverage partners to create progress and where there may be additional needs.
Thank you very much, Dr. Vanessa and Deputy Madam Chairperson and all Excellencies from protocols observed. Thank you for the opportunity to share some of the experiences on investing in health and care workforce of Ethiopia. I think you have all seen investing in health care workers is a critical pillar of our health system, particularly what we have seen in the last few years within the pandemic. And of course, the last few decades, Ethiopia has been one of the areas of government commitment has been investing in health workforce. And of course, the first one, it starts, of course, with training the different cadre of professionals we need for the health system, starting from our community health workers, which we call health extension workers, up to the different diverse specialties that we need. So the first one, of course, seeing the critical need of accessing primary health care for the vast challenges we had. So around 17, 18 years ago, the community health program was established, and that's when training of these health extension workers started with, of course, with the an evolving kind of curriculum every time, because we have been reviewing the need of the community and the need based on the services that they have been providing. So the package of training was evolving through time, but this training from level 1 and level 2 to level 4 trainings, which is almost equivalent to diploma nursing. So they have this formal training, and they are formally hired by government on government payroll. And then, of course, this had its own huge impact in reducing communicable diseases, maternal and child mortality. But beyond the community health workers, also expansion of the different professions and training programs across the country was a big focus, from nursing, the different nursing programs, and medical doctors. So medical doctor training, for example, was expanded from, for a long time, we only had 3 medical schools for the country, which is now around 28 public medical schools, which we have an additional private medical schools. So that was a huge shift with a strong government commitment, and progressively we're working on expanding the residency programs, particularly in different key specialty areas like OBGYN, surgery, and others, which are critical for addressing the health needs we have. But also in terms of public health emergency, we've been also expanding training programs like epidemiology and lab training programs, emergency medical technicians in the recent years, which had actually, for example, the epidemiology, field epidemiology was started for the Ebola preparedness, but it was key supporting the health system when we had the COVID outbreak. So this, and also there were some task shifting trainings that we had established. For example, one of the key challenges we had is a high maternal mortality, which could not be addressed by the very few doctors and OBGYNs who are training. So at some point it was decided to train surgical officers for 3 years as a graduate program for those health officers. So they have been serving in primary hospitals. We have trained around 800 of them and serving in different primary hospitals. But of course, as I said, we have to evaluate and make other course corrections or change on how do we continue to those task shifting. Since we have now a large number of doctors being trained, that large number of surgical officer training has minimized, but we are continuing to do that. So training, expansion of training is a key aspect of the pre-service aspect, but also the quality. So the key aspect of working with Ministry of Education in terms of competency-based curriculums and expanding our simulation labs, but also beyond the training, introducing licensing exams, standard exams, and mandatory continuous professional development trainings for those who are already on the job has been crucial. And of course, we've had a lot of in-service training programs, but they were not required to practice or to be relicensed. So now we are moving to that direction because this is critical to maintain quality. This helps motivate the workforce, but also ensures quality of care. So beyond that, one other critical pillar we have been in training is the leadership training of leaders within the health workforce, which has been a big gap, also a challenge. So there are different, I may not want to go into the details, but trainings like formal ones like Masters in Healthcare Administration for hospital leaders, but also recent training programs we are doing on leadership incubation programs to bring emerging leaders into the health system is one of the focus areas, because that's one of the gaps we have seen in the health system. But within all this, gender lens has been one of the critical issues, which is both in terms of ensuring that enough number of female trainees enter into the medical schools or other training programs and enter into the workforce. And now we are also looking into how do we really enhance them entering into the leadership, because now the large number of health workforce actually are women. But when you look at the leadership aspect, there are very few. So looking into those aspects is one of the areas we've been looking at. But also, it's not just training and not just ensuring that competence and quality, but also ensuring motivation is key. So really creating what are the conducive environment we can create, and ensuring protection and safety during problems like the pandemic, but this is an area which is very challenging, particularly in countries like ours, because we know we have low pay and many other factors. Also, we are trying to introduce different mechanisms to push this agenda, but this requires collective support. So, but all this I have spoken, there's a critical pillar of partnership. How we have achieved what we achieved so far, we still have so many gaps, but for what was achieved so far, partnership at different levels has been really crucial. And to highlight few, particularly for our training programs, collaborations between academic institutions, was north-to-south collaborations and south-to-south collaborations have been key. I think it has been more towards the north-to-south collaboration, and I think especially as African Union, we have to really look at what are the opportunities for south-to-south collaborations to expand. We have some of them, but not enough, which we can really leverage. And also, of course, the different partnerships with donors, implementing partners in the private sector, and work that we've had to expand all the key areas. And I think especially within the pandemic, we have seen very strong collaborations like with Africa CDC, WHO, and others to train our workforce to really be able to prepare to respond to those emergencies. But I think this should be institutionalized so that we have our workforce ready for different pandemics, and we don't have to run to train them once we are in the pandemic. So I think these are a few things I would like to share. Thank you so much.
Thank you so much for those comments and for the extraordinary journey of investing in the workforce that the country has been on. I appreciate to be able to hear some of that. And I appreciate also the highlight of the fact that many women are in the workforce. As we know, about 70 to 75% of the workforce is women, and yet only 25% of the positions of leadership are occupied by women in health. And further, there's up to $3 trillion of unpaid work being performed by women in the health systems. And when we think about that, the role of women and how we are going beyond, I feel like I've been hearing these statistics for a while now. The question is, what is the action point? And we are here for action. We're here to motivate partnerships to change and to create the progress that we seek. And with that, I'd like to ask Professor Roballo kindly to speak about what are the partnerships that we need to create. What is the role of partnership to galvanize action to actually transform the agency and recognition and role of women in the workforce formally?
Thank you very much. Moderator Dr. Vanessa Kelly. I would like to acknowledge the leadership in this room, the Deputy Chairperson of the African Union Commission, Honorable Commissioners, Honorable Ministers, the invited guests. Hello. There's a pillar.
There's a pillar, but my kind colleagues here from Last Mile.
There's no partnership if we have pillars. Women in Global Health and myself are very grateful to the Africa CDC and the African Union for the invitation to participate in this very important conversation. I think I have 3 points to make around partnerships. I think, first of all, it is really to be acknowledged this important step forward that the Africa CDC and African Union are taking in terms of reimagining the development of the health workforce for the continent. It takes several crises for us to then get energized, but at least we are getting energized. I'm saying this because this is not the first crisis we have. It's not the first initiative. I'm not saying from the African Union, but if you think about the crisis by HIV/AIDS, and all the initiatives around task shifting, role shifting, etc. It was trying to address the shortage of healthcare workers, but it didn't go far. We are still talking about task shifting, role shifting, surgeons trained in short programs of 3 years. They're trying to put short-term solutions to a long-term problem. And I think, and I hope, this time we will take off. So that's important for partnerships, I think. We really need to embark on this with a level of ambition that will make it sustainable and will carry the vision forward. If we don't start with that, it's going to be a short partnership. In 5 years' time, we'll still have the same problems, and then there will be another pandemic. We'll be running after the health workers that we didn't train, we didn't skill before. That's the first point I wanted to make. The second point, which I think is also important for partnerships, is for us to look back into what have we done of the 100 billion invested in Africa over the past 20 years by PEPFAR. Dr. John Kenneson, Ambassador, just told us. This morning, Global Fund, or since yesterday, has been telling us how many millions they have invested to support AIDS, TB, and malaria, with the components also for strengthening health system. We also know that the UN system invests in health system strengthening, particularly WHO. Gavi invests in health system strengthening. There is a component for health workers, etc., etc. What have we done of all these resources? What have we done of all these partnerships for us to find ourselves today looking into health security and then having a major problem with health workers? So I think if we are going to reimagine the development of health workforce for the continent, we need to learn lessons from the past 20 years of partnerships and then see what it is that we're not doing well. So that 20 years after all these big major programs, we still have these huge gaps in terms of women resources. WHO estimates that we have, I think, 14 to 15 million health care workers shortage for us to achieve universal health coverage, and most of these gaps is in the African continent. So there is a long way to go, and we need to be taking this seriously. My third point, before I tell you what Women in Global Health is proposing to do together with the Africa CDC, and then I'll conclude. The third point is just being highlighted also by Minister Tadesse, is about the fact that 70% of the women, of the health workforce is made up of women. In some places it's 80%, 85%. We also know that the African population is about 70% of young people, 60 to 70%. Most healthcare workers, particularly frontline health workers, are not paid or are poorly paid. You have mentioned the 3 trillion of work that is done unpaid. Women are absent, invisible, or sidelined from decision-making policies within the health sector. Dr. Leah Tadesse, Minister from Uganda, Ruth, and a few others are just the best examples we have of women leadership when it comes to global health in the continent. Most ministers and decision makers are men. Yet most health workers are women. The women deliver healthcare, which is led by men. So this is important to be borne in mind if we are going to reimagine the development of the healthcare workforce. If gender transformative policies are not part of the reimagination, there will be no sustainable partnership for us to move forward. Then finally, Madam Chair, Women in Global Health is in discussion with the Africa CDC to look into the different programs they have to streamline leadership within the public health, the new public health order that Africa CDC is moving forward. And we have been thinking about the young women, early career young women within the healthcare setup, to move them through the leadership pipeline. I said, and we all know, Africa is a young continent, so we need to invest on women, we need to invest in young people. Our proposal is that we create a leadership program for early career young women, health workers, so that we build a sustainable workforce that we want. We actually propose to call it after Mrs. Graça Machel, because I think we have seen the Kofi Annans, the Mandelas, the Obamas, nothing against that, but I think it's time that we have one of these leadership programs named after a woman. So we are looking for support, financial support. I think we are still finalizing the discussions with Africa CDC, but this is something that we think can make a difference in terms of reimagining the health workforce within the continent. I will conclude with 3 points again. One, as we say, there will be no new public health order without women and without young women. We really need to put women and young women at the center of the reimagination that we are making. My second point to conclude will be that we need the level of ambition that will match the size of our problems. Our problems are big, and our ambition needs to be to the size of our problems. If we put the band-aid into the problem, we will come back to a bigger problem than we had before. And then finally, gender equity needs to be at the center. We need gender transformative policies as a foundation for us to be able to move forward. Probably I've taken more than the time I was allocated, and I thank you for listening to me.
Thank you very much for those very succinct, powerful, and very needed points. I want to very much highlight that we have to be as ambitious as the problems there are, if not more, right? As we seek to move things forward. I would like to take a moment actually to begin to kindly ask for some comment from the audience, and I'd like to ask the Honorable Minister of Nigeria to please speak and to give reflections on the health workforce in the context of Nigeria.
Well, thank you. Again, the problem in the African continent is the same everywhere, I believe. Not enough workers, a lot of work to do. And now we're seeing a different problem of health workforce migration. So the question of how to get the right workforce that you need for your country, I think we'll have to resolve individually for each country with the opportunity we have like now to compare notes. In Nigeria, across the board, there is a shortage of manpower. We have shortage at the primary healthcare level, where we focus largely on community health and extension workers. We operate 36 states in a country where each state is actually responsible for care at the primary level, which is not the federal government that does that. But the level of activity that goes on between the state governments and the health service varies, depending, of course, on the focus of that state government, and does not always align with the federal thrust. Nevertheless, the federal government does push very hard for even development, opening schools of health technology to support training of healthcare workers at primary level, and nurses, and ancillary workers, professionals, radiographers, laboratory technologists, and so on. All of them are trained at the university, and doctors. Now, paying the health workers is a problem. So we have a problem of not enough workers, and those who are there are not everywhere paid on time or paid an amount that they think is commensurate. So we are working on a strategy that will take a good look at that problem across the states of the Federation and try and see how to improve service conditions for health workers generally, and remuneration for health workers from the US level to the highest level. Of late, we are seeing a lot of attrition, workforce migration to other countries. The troubling part is that a good number of them, in fact most of them, have been trained at taxpayers' expense and leaving the country to work, or let us say serve in other places where the pay is better. It's an issue that lets us start thinking about, well, if you're trained at taxpayers' expense, I think you should probably be bonded for a few years to serve your country before you move on. The other aspect is trying to engage a health workforce who are in the diaspora. There are a large number of persons who have migrated abroad and acquired a lot of knowledge and skills which we think we can make use of. We call them the Nigerian diaspora, either in using digital technology to deliver lecture modules or to do telemedicine consultation, remote consultations, and in fact occasionally to come in to do hands-on service and hands-on service delivery. The other hope we have now is the development of the health insurance, which brings a large, or rather hopefully a large amount of money into the health space. We have very high concerns about how much money, how much investment comes into health. It is far more a social service now than a business-oriented service. So we are looking at how to balance making healthcare both a business at the same time a social service, where the government provides money. We call it the Basic Healthcare Provision Fund, to buy insurance for those who are vulnerable and poor, and looking at raising taxes from tobacco, alcohol, sugar, and so on, to support the health sector provision of services to the poor and vulnerable, and to also improve the structure. By and large, the investment that came in from the COVID-19 pandemic has strengthened the health system. We have been able to improve the infrastructure, expand the network of oxygen plants, isolation centers, ICUs, laboratories. All those ones are there. The workforce development is what we are going to be facing now, and looking for ways of getting the balance between what the state spends on training, the health workforce, and what they give back to the state in return for the training they have received for their own good.
Thank you very much. I would like to call on one of our other partners who's in the room, Sept, who is here and has joined us. If you could please, just 2 minutes. I know we are late and there's a few more brief comments, but I would love to hear, if you don't mind, from you, where you see opportunity to really galvanize investment in the workforce, and what are the opportunities that we need to try to action or really act on in this moment. Thank you.
Thank you, Vanessa. Excellencies, all protocols observed. One of the incredible opportunities that we seem to not take advantage of as much is South-South collaboration, as Minister Leah mentioned. I think over the last 2-3 decades, many of us, the diaspora on this side, had galvanized the institutions we worked in to build very strong partnerships in Ethiopia, Ghana, so many other countries. I think it is high time that we now start looking into those institutions that are ahead, to use them as a platform to advance South-South collaboration. I think there is incredible momentum. In fact, tomorrow we have a meeting with Africa CDC, some donors, some health ministers to really get commitment and an actual resource allocation around community health workers training. Africa CDC has been leading this effort, but the AU in 2017 had declared that we will train 2 million community health workers. Right now, if you look at Africa, of the million community health workers, only 150,000 are paid. The rest of them are mostly volunteers. So having a paid, I think we have examples. One of the things we need to do better on is looking at examples that are working and scaling them up. Ethiopia has done a fantastic job training close to 40,000 female health workers. That's your way for gender equality. That's your way for paid workforce. That is structured, that is part of the formal workforce. So we do now, I know there are so many other initiatives on implementing, but we are now working on a new initiative trying to raise several $1 billion that will go into community health workers training in Africa, and we plan to do this with Africa CDC in the lead along with other global partners. So thank you for your leadership in this space, and we look forward to continue to collaborate with you.
Thank you for your comments. I appreciate it. I would now like to ask for comment from a very patient colleague and partner here, the representative from the International Federation of Red Cross Red Crescent.
Thank you, Dr. Vanessa. I think we have done so long, I don't want to say much. I just want to say, and as you said before, I think we should believe in action, not so much on words. I just want to say 2 initiatives we are working with Africa CDC. The first one is around this communication and community engagement to get to 70% vaccination coverage across the continent, Africa continent. We started this program and it goes all across Africa. So I think that's a concrete partnership we want to build up so that we can reach the 70% vaccination coverage. And the second one is, I think we all heard about the need for community health workers. We have been now working together with Africa CDC next 5 years to try to train 2 million community health workers in Africa. So these are the 2 concrete actions we want to work together with Africa CDC. I don't want to take any more time. Thank you.
I'm very appreciative of your call for action. I am in agreement. And there's one more comment from the floor that I would like to call for, which is from our colleagues from AFNET, and this will conclude our program after this comment, because I know many people have pressing comments. So if I could have just 2 minutes, please, from our colleague from am I looking in the wrong direction? There we are, excuse me.
Thank you very much. I think this meeting has come at a very opportune time. The African Field Epidemiology Network has been working with the Africa CDC, supporting field epidemiology and capacity development. Addressing the workforce gaps in Africa and doing so in a manner to reach the critical masses very quickly, in a manner that will enable Africa to respond effectively to the various health challenges would require a revolutionary approach. It will require an approach that allows for sustained expansion in the training capacity for health workers in the continent. But also very important is that it will require that we put in place the needed policies, but much more important, it requires that we translate these policies to allow for us to address the issues, the challenges that result in the exit of health workers from the continent. I think if we can do that, if we can sustain the training and address the issues of health worker migration over the period of time, we would be in a position to have a critical mass that will enable us respond to the various health challenges. Thank you.
Thank you very much. And with that, I'd like to turn it back, please, to our lead.
Thanks to everybody for their very pertinent contributions to all the 3 sessions. Indeed, thank you for your patience. I know we are running a little bit over time. New York is still awake, so I'm sure we'll be able to get to where we need to be next. After all the discussions, I would really like to ask of the Honorable Minister from South Africa to just put it together for us in terms of a reflection in the form of a communique of all that has been discussed here today before we go into the closure. Honorable Minister, you have the floor.
Thank you very much, Honorable Chair, and thanks to all the colleagues, all the contributions. As we conclude this very rich discussion on reimagining health workforce development in Africa for Africa's health security, on this high level, on the sidelines of the 77th UN General Assembly on this date, we want to pledge to say we, African Union heads of state and government and heads of delegation participating at this special side event on reimagining health workforce development in Africa for Africa's health security at this the margins, as we've said, of the 77th United Nations General Assembly, mindful that Africa, a continent of more than 1.3 billion people, continues to experience the highest incidence of public health emergencies annually. We are deeply concerned by the detrimental impact of ongoing COVID-19 pandemic across Africa's health, security and economic sectors. Further concerned by the potential negative consequences of existing public health emergencies, including monkeypox outbreak and persistent pandemics of HIV, tuberculosis, malaria, maternal mortality, non-communicable disease, and the impacts of climate change. Recognizing that Africa bears 25% of the global burden of disease and has only 3% of the world's health workforce. Recalling the commitment by the African Union member states to meet the Abuja Declaration of allocating at least 15% of our annual budgets to the health sector. Noting the AU Heads of State and Government Declaration, Declaration EX.CL/1021-31 on accelerating the implementation of international health regulations in Africa. Noting the critical shortage of health workforce in Africa, projected to reach about 6.1 million by 2030, which is made worse by numerous public health emergencies and challenges with securing relevant medical tools for their use. Recalling the AU Assembly decision, Assembly/AU/December.64929, that urged the African Union Commission together with UNAIDS, WHO and other partners to rapidly recruit, train and deploy 2 million community health workers across the continent when and where they are needed. Further recalling the AU Assembly decision, Assembly/AU/December.435, that called on AU member states to accelerate investment in health workforce development. In health workforce development, Africa mandated Africa CDC to champion health workforce development in Africa and established a health workforce task team to support this continental drive. Appreciating the progress made by Africa CDC in contributing immensely to increasing the quality and quantity of African public health professionals through the delivery of tailored capacity building and strengthening initiatives on public health and leadership competencies. Welcoming the immense efforts of Africa CDC in responding to COVID-19 in our continent through targeted capacity building and strengthening initiatives geared towards scaling up capacities in laboratory diagnosis, including pathogen genomics, events-based surveillance, field epidemiology, and risk communication, amongst others. We, the heads of state and government, hereby call for further investment in health workforce and a new compact for health workforce development in Africa, which includes 1, redefining and building a fit-for-purpose health workforce. Call upon African Union through the Africa CDC to establish the Health Workforce Task Team to implement a compact for health workforce development in Africa as per the Assembly decision. Call upon Africa Union member states to mobilize all sectors such as health, veterinary, labor, education, and finance to stimulate health workforce training, deployment, and retention. Call upon African Union members to collaborate and cooperate through compacting in order to agree on a set of evidence-driven targets aligned towards attaining the set targets through policy harmonization and promote accountability. Call upon African Union member states to ensure all workforce are adequately remunerated, particularly community health workers and female workforce. Number 2, investment in the female health workforce. Call upon African Union member states, the AU Commission, Africa CDC, and partners to mobilize resources for investment in and promotion of women's optimal participation in the healthcare sector, including leadership roles. Call upon African Union member states to establish a framework for investment in women health workforce to ensure systematic and institutional recognition for women's contributions to the health sector and to ensure pathways for promotion and advancement in the workforce with special attention to women's leadership. Number 3, accelerating private sector engagement and domestic financing. Call upon African Union member states and partners to accelerate domestic financing for a fit-for-purpose health workforce to ensure sustainability and return in investment. Call upon partners including bilaterals, multilaterals, and finance institutions to mobilize more sustainable financing for health workforce investment. Call upon African Union member states to provide an enabling ecosystem for collaboration with the private sector to leverage their technical and financial resources and to ensure regulation and oversight. Number 4 and last, transforming and strengthening monitoring, evaluation, and learning for health workforce. Call upon Africa CDC with support from Africa Union member states and partners to design, develop, and facilitate adoption of comprehensive metrics to evaluate progress and impact of the investments in health workforce. And lastly, call upon AU member states to document the socio-economic impact of investing in health workforce and progress towards the Sustainable Development Goals and Agenda 2063. Thank you.
Seeing how late it is, I would like to call upon the Honorable Deputy Chairperson of the Africa Union Commission for her final words of wisdom, and then we can adjourn for today. Excellency, you have the floor.
Thank you so much. Good afternoon, good evening. Honorable Minister, here representing His Excellency Mr. Cyril Ramaphosa, President of the Republic of South Africa, who is also our African Union COVID-19 champion. Your Excellencies, Honorable Ministers, Ambassadors, my dear sister, Commissioner Minata, Acting Director, Africa CDC, who is also hosting us today, dear partners, on behalf of the African Union Commission, I would like to say thank you for participating in this important event. In my view, it's been an extraordinary one. Extraordinary in the sense of the complexity of the issues that were discussed, but also extraordinary in the wide range of views and opinions that we have heard and expressed. I believe we have achieved the set objectives for this gathering. Over the last couple of hours or so, we have been unpacking what it takes for the African Union member states to have well-trained, appropriately distributed, and optimally resourced health workforce in adequate numbers. And as we have heard from our various distinguished speakers, the limited training capacity, the loss of healthcare workers to COVID-19, and brain drain have resulted in a critical gap on the African continent. And this is further alarming as Africa bears 24% of the global burden of disease. I believe that the discussions at this side event on the margins of the 77th UN General Assembly has laid the groundwork for positive actions towards health workforce development in Africa, for Africa's health security. By focusing on advocacy, investment in health workforce development, health workforce measurement metrics tailored to the African context, application of gender lens to the health workforce development agenda, and resource mobilization, we are building on foundations laid at the February 2022 35th Ordinary Session of the Assembly of the African Union Heads of State and Government. It would be recalled that then His Excellency President Cyril Ramaphosa, the AU COVID-19 champion, articulated recommendations needed to ensure a resilient recovery of Africa's health system and highlighted the need for a critical mandate for Africa CDC to champion health workforce development on the continent. The issue we've been discussing this afternoon is very urgent. Reaching the targets set by the African Union and UN agencies to accelerate health workforce development globally and in Africa specifically will not be easy. I'm convinced that with collaboration, coordination, and true partnerships, all will be possible. If I could reiterate some of the key points that we have discussed or transpired in today's discussions, without taking the risk of repeating from the key outcome of this event that the Honorable Minister just shared with us. Allow me to just, by way of emphasis, state the following. We heard that there is need to mobilize all the sectors, such as health, veterinary, labor, education, and finance, to stimulate health workers' training, deployment, and retention. We also heard that there is need to ensure all workforce are adequately remunerated, particularly community health workers and female workforce. We also heard that there is a need to develop leadership programs for the female workforce. We also heard strong messages about the need to mobilize resources for investment in and also promotion of women's optimal participation in the healthcare sector and in leadership roles. There is a need to accelerate domestic financing for a fit-for-purpose health workforce to ensure sustainability and return on investment. Another key message that was put across is to provide an enabling ecosystem for collaboration with the private sector to leverage their technical and financial resources and to ensure regulation and oversight. Last but not least, we heard about the need to design and develop and facilitate adoption of comprehensive metrics to evaluate progress and impact of the investments in the workforce. With this in mind, the African Union Commission is committed to working with all of us and support our member states to achieve these outcomes. We have the Africa CDC as the arm of the Union to spearhead a lot of work that is lying ahead of us in this regard. Our commitment of the member states transpired a great time. We congratulate them for the efforts. And we wish to thank them for their leadership and vision. Furthermore, we appreciate the commitment expressed here by our several partners, traditional partners and new ones, who are ready to continue support our member states to achieve this goal. Sincere appreciation goes to our distinguished speakers, esteemed participants, the MasterCard Foundation, and the African Union staff for making this event successful. To conclude, the test of a meeting like this one is not the production of a plan or a report. The test is whether better understanding of the issues and each other's position can be translated into positive action within our own areas of influence. I thank you for your participation and for the opportunity to close this very successful event. Thank you so much.